Thank you.
We're going to be doing upper thoracic forward bending and upper thoracic rotation PIVMs. PIVM stands for passive intervertebral motion. Passive intervertebral motion. So what we're going to be doing is feeling the spinous processes, and we're going to see how much those spinous processes move. Based on how much they move, we're going to interpret how much motion is happening at the facets. So it's kind of like an indirect way to palpate and assess the facets. Okay?
With the idea that
Can I see the slide model? I'm listening.
with the idea that the spinous processes are moving in a proportional amount of facets.
Exactly. So we are going to be putting our fingers on one or two of these spinous processes. We're actually going to be right in between the spinous processes. And you can see that as I flex the spine, you can see how those spinous processes move apart. There's space that's created there in between there, and then there's also tension that's created between the ligaments. Okay, so that's what you're really feeling for. You're feeling for movement of the spinous process and tension that's developing between those spinous processes. If you look closely, you can also see as we flex the head, both of those facets are upgliding as the spinous processes are moving. Okay? This is a nice bendy spine, so this is a good one to look at. So I'm going to have you sit up really tall. Yep, perfect. And what I'm going to do is I'm going to put my hand kind of on top of your head or your forehead, okay? So I'm going to put my hand kind of more on her forehead, and I'm going to flex her about 10 degrees. 10 degrees is going to be the loose pack position of the cervical spine. Now I also need to confirm kind of where I am. So first, actually, can you just look up to the ceiling? Good, and then relax. Do one more time. Good. So I'm confirming where I am at C6 or C7. We know as she goes into extension, C6 will move away from your fingers, and C7 will stay present. So I just found my C7 is here, okay? We're gonna start at a C7 T1. Okay, so my finger is right now on the C7 spinous process, and I'm gonna move it to just in between C7 and T1 spinous process. Now I think in the picture it just has one finger palpating. I'll tell you my preference is I like to put one finger in between C7 and T1. And I like to put another finger in between T1 and T2. I'm going to go under your shirt here, okay? And then another finger in between T2 and T3. Okay? So I'm palpating multiple segments at a time. Now, as I slowly flex her, I put her in that loose pack position, and as I slowly flex her, I'm going to feel that spinous process move right there. I feel it move. Okay? Why I like to use more than one finger is I know I only feel motion at my top finger. If I just flex her really fast, well, I've already recruited motion all the way down. So you've got to go really slow, and I'm trying to isolate one joint at a time. So that's why I like to use a couple fingers, so I can make sure I haven't recruited too quickly or past the joint I'm trying to assess. Okay? If you just want to do one finger like the picture, that's fine. Just make sure you're not recruiting too quickly. You understand what I mean when I say recruiting, like developing tension, creating movement? Okay, I'm just going to move this a little bit. Yep, you're good there. Thank you. Look up for me again. Good. And then back. All right, so we've got her C7. I'm going to put my finger in between C7 and T1 spinous process. I'm just going to put her in a loose pack position and then slowly flex her. Right there, I feel motion develop. Go to the next segment, T1 and T2. I feel tension develop with about the same amount of flexion. T2 and T3, motion there. T4, what am I at? T3 and T4. Good, and she's got good motion. She can recruit just a little bit more even into T4, 5. So, what I'm looking for is how much flexion, I'm not getting out my goni and actually measuring, but how much flexion does it take to develop movement at these spinous processes, right? Does it recruit really fast with just a few degrees? Or am I going 10, 15, 20 degrees before I feel motion?
And is that indicative of how tight the capsules are?
So here is going to be more of a quantity assessment. We're not getting a true end feel, right? So we're looking at, if tension develops really quickly, likely it's because it's stiff, right? There's not a lot of movement there. All of a sudden, tension is created. But if it just goes and goes and goes, and then finally you feel movement, it's probably because of the laxity. It's taking so much longer to create that tension, right, or that movement there because there's so much slack in the tissues. So if it's taking more motion to create movement, likely a laxity. It's where my thought process would go. If I just barely move her and I feel these, likely a hypomobility. And we'll find some other ways to more specifically or directly assess quality end feel to see, is it really muscular, is it joint, is it ligamentous, etc. But for now we're just looking at how much are the spinous processes moving. Thinking about how much would the facet be moving. You guys doing okay?
So is there a way to determine like normal? Because if it takes a while for there to be movement, there might be laxity, but if you feel tension right away, there's tightness. So what's normal?
That's a really good question. It's going to be different from person to person. And so I would maybe work on, someone who's really like petite and kind of generally mobile, and then work on maybe someone else who's kind of big and stiff to see what that is. Now, a few things here. Sit and have really bad posture for me. There you go. So that's why first thing I did was tell her to sit up really straight. So if she's here, look at how she's already, you see that line in the back of her neck? That's where she likes to hinge, right? That's a hinge pattern. Typically, when people sit like that and you see all those lines in the back of the neck, that's going to be an area of hypermobility. Okay, so those are just easy things on your structural inspection to see, hinge patterns. Really common, she's like lower mid-cervical, she's seeing that hinge. So do you really think I'm going to be able to assess her inflection here? I'm probably not going to get any movement through that upper thoracic. Finally I am, but look at her thoracic spine's already so flexed, right? So it might be difficult just based on their posture too to do this technique. So sit up really tall, right? Or put her in the loose pack position, and then I can start to develop tension from there. Okay. So it really varies. Some people you'll see have like a little dowager's hump. And that's just like a genetic thing that you're not going to change, but you get this like increase in adipose tissue and even fluid and soft tissue that'll just accumulate here, and it'll just look like a little prominence. So these are the people that need a lot of soft tissue work here, and definitely mobilization in this area, typically an area that starts to get stiff. But we know, because most people sit in that bad posture again for me, are sitting here. This mid-cervical spine becomes the hinge. That mid-cervical spine is going to become the hinge, and this upper thoracic is going to get really, really tight. So we need to work on stabilizing that mid-cervical posture, deep neck flexor activation, and then we need to work on mobilizing this upper thoracic area.
Can you still feel it over the downward?
It's hard. Yeah, that's what I was going to bring up too. It's hard to feel. If there's a lot of soft tissue here, it is difficult. So that's when you want to look at how much tension do I feel developing. If you can actually feel the SPs moving, that's great, but then you might have to think about just tension itself. It is more
And
challenging.
is that something you feel more here, more like what you feel in an MLT? Are you feeling more of the tissue resistance as opposed to the movement under your finger?
So think like interspinous ligament. That's what you're kind of palpating and feeling move, right? Because if these
So
are your
you're not
SPs, you're just feeling that. You're feeling tension develop there. Even though you can't directly palpate the SPs or differentiate between soft tissue and spinous process.
So if you had like an obese patient, the same thing where you would have to sink way down to be able
Not
to
always. Even if someone has more soft tissue, as we start to practice, I think you'll see, but it just is so thick. There's just so much tissue there that sometimes it's harder to palpate. But some people have really big spinous processes. Some people have really tiny spinous processes. The spinous process is actually like the one bone with like the most anomalies. So especially in the thoracic. So you kind of have to take it with a grain of salt. Maybe they just have a really small spinous process, and that's why I'm not feeling movement. Or maybe or what do I want to say, like C7 spinous process differently shaped than T1, so that's why motion is off. Again, you have to factor everything else in. So.
Be careful with vertebral artery, like in certain
Not with
up
this
glide,
test.
down glide.
We'll talk a little bit about that, but not for this assessment. Yeah. Okay, so we've got flexion. while we're on it, we're gonna do the same thing with, you can do the same thing with side bending, you can do the same thing with rotation. I'm gonna show you rotation, it's a little bit more functional and I think easier to feel, okay? So if she rotates to the right, what direction are the spinous processes going to move?
Opposite.
Think spinous process. Where this is her spinous process, right? As she moves to the right, her spinous processes are going to swing to the left. Okay? So when I do this, I would probably stand directly behind her, just for video and so you guys can see. I'm going to stand off to the side though. Okay? So I'll stand on this side. I like to rotate her head away from me, and I'll palpate those spinous processes coming into my finger on this side. Okay? So we're going to set it up exactly the same. She's up nice and tall, seated. Go ahead and look up for me. Good, and then relax, and then look up again. Okay, so I found her C6 and her C7. So instead of being directly on the spinous processes, I'm actually going to be just lateral to the direction they're going to swing, so that I can feel it bump right into my finger. Okay, so I just moved just lateral. And then again, I've got my finger in between C7, T1, in between T1 and T2, and in between T2 and T3, okay? And so first I'm just gonna I'm gonna put her in that loose pack position, so I flex her just a little bit. It kind of recruits motion through the mid-cervical spine, so you don't have to move as far to recruit motion into the upper thoracic. So I put her in that loose pack, and I'm just gonna start to rotate her away. You can see I'm kind of gripping her hand like I was gonna pick up a basketball almost, and I'm just kind of guiding her head. So now I start to feel motion at C7, T1. I'll wiggle my fingers down, rotate her a little bit more, feel motion at T1, 2. Rotate her a little bit more. I'm not feeling as much motion at T2, 3 there. Let's see. Come back. Let me see if I recruited too fast maybe. So I'm at T2, 3. I'm starting to feel motion there. I'm not feeling as much motion at, T2, 3 and T3, 4. Definitely not moving as much, so that might be a hypomobility. Okay. She flexed really well, but she's not rotating very well to that side. And I need to correlate that with her actual active range of motion and passive range of motion. I'm going to come to the other side and check her rotation to the other direction as well. Again, have her sit up straight, find my C6 and my C7, start at C7, T1, put her in the loose pack position, and then start to rotate to feel. It actually seemed like you move a little bit better this way now. Still that T2 and 3, T3, T2, T3 doesn't move. You finally get motion at the very end at T3, 4. But T2, 3 might be a little hypomobile in both directions for her. That's what I'm thinking based off of this PIVM, passive intervertebral motion assessment. Think you can handle it?
How far were you going away? Like a finger?
Yeah, just a finger width. Just, I'm on the spinous process and I move a finger width lateral. Not very far at all. So I can still feel the lateral side of the spinous process. And then I can feel that relative movement. Let's do it. Ready? 1, 2.